Thank you guys so much for being with us tonight. My name is Rebecca Mazer. I know that I've chatted with a lot of you guys. I'm seeing all the names pop up right now. I am the senior manager for the academic and relations team. I work directly with District 7, so that's UIC, SIU, Indiana, Marquette, Midwestern. Who am I missing? Kentucky, Louisville. So I help the students get in touch with recruiters, answer questions. I get you in front of our awesome doctors like Dr. Bo so that she can answer questions that you guys might have regarding joining Aspen, her journey from student to dentist, and now MCD. And really quick, just a little tidbit on Aspen Dental. So I work for Aspen Dental Management, ADMI, which is basically the support system support organization for our doctors like Dr. Bo. So ADMI does all of the back office, the hiring, payroll, ordering of supplies. We basically do everything business related so that our doctors can focus on dentistry. So today we have an awesome guest who is going to spend 1 hour with us and is going to answer all of your guys' questions. Now, again, you guys had an opportunity to ask questions through our portal, which we have quite a few already. But if you guys have any questions you want to ask right now, follow-up questions, there's a little Q&A box at the bottom. You just click on that and it'll pop up on my screen and my screen, and I can ask those to Dr. Bo. You guys are not on camera, it's just me and Bo, so do not fret. And also you can ask questions anonymously. So there's a question that you don't want anyone else to know it's you, whatever the case is, not a problem, just ask it anonymously. And then if you have questions after the fact, you guys are welcome to stay on or text me and I'll give you guys my information as well. Awesome, so we're gonna get started. Dr. Bo, again, thank you so much for being with us tonight. Give us your story, again, like your school, where you work, kind of your path, and then also give us a fun fact.
Hi guys, thanks for joining us tonight. My name is Boyan Bartolata. I go by Bo. I went to UIC, I graduated in 2017, and I went to New York for a year to do GPR. I did 1 year at New York Presbyterian Columbia. And during that time, I was moonlighting at a private office. It wasn't really the right place for me. So after GPR, I decided to join Aspen. I joined Aspen in October of 2018. And now I am practicing in Algonquin as the managing clinical director. Fun fact, I have a dog named Tiger. Good timing there. I apologize in advance. He barks a lot. He might get me kicked out of my apartment really soon. But yeah, he weighs 10 pounds, but he barks very loudly. So sorry about that.
It. Hi, Tiger. All good. I have my 2 Frenchies that are probably going to be scratching at the door here in a little bit. And my other fur baby that'll probably be screaming here in a little bit. So you guys will be listening to all sorts of noises. Awesome. So Bo, you graduated from UIC, you did a GPR, and then what was your first office?
My first office with Aspen?
Yeah.
It was in Gurnee. I started out as an associate. I was the second dentist there, and I trained there, worked there for about 6 months.
Okay, cool. And now you've become a managing clinical director. Can you explain what that role is and the difference between that and associate?
So the associate is mainly there to do what is on their schedule. They are oftentimes new dentists, new grads, so they're not fully comfortable doing a lot of surgical extractions. As an associate, you still have full control over what you want to do, what you don't want to do, but it's mainly to allow yourself to kind of get used to working in a fast-paced environment, learning how to treatment plan, working under a mentor. And the MCD is more of a leader of the practice. Right now I do a lot of everything. I do feel very comfortable doing a lot of things. Also, managing how to run an office is something that I think I took on as a new role as an MCD. So just making sure that, the staff is happy, and also training new associate doctors as they come on.
Okay, awesome. So you basically run that practice as if it were your own. And
Yes.
you are a mentor to the associates that are coming in.
Yes.
Awesome. Okay, guys, for those of you that have jumped on, again, you are welcome to ask any questions. There's a Q&A box right at the bottom. Those I will pose live to Dr. Bo. But we'll get started with some of the questions that you guys have submitted already. So first question is, of course, this is the first question. Do you have any regrets about joining a DSO and anything you don't like about Aspen? Now, of course, we want you to be transparent and completely honest, so go for it, Bo.
I guess the answer to the first question is no. I have no regrets joining Aspen, even though it's a very large DSO. We do have a lot of patients, so I guess sometimes seeing so many patients a day, it could be physically draining. But at the end of the day, like, my goal right now is to build the foundation for my career. And in order for me to do that, I have to have the patient base and have that clinical experience. So for me, like, so far, and I'm being absolutely transparent, I have no regrets with joining Aspen. I've had such a great experience from as an associate. Now being an MCD, like, I do have a lot more responsibilities, but I think the rewards are also bigger as an MCD. So yeah.
Absolutely awesome. Now, did you have mentorship when you joined, and what did that look like?
So yes, I did. The MCD in Gurney was the one that trained me. So before joining Aspen, like, I had no molar endo experience. So that was something that I wanted to explore a little bit more. So having the MCD there as a mentor, he was very experienced, he was very competent. So I told him, hey, I wanted to try doing molar endos. If I get stuck, can you help me out? And just clinically, he was able to, like, bail me out when I got stuck in a procedure, when I was seeing new patients and wasn't getting good acceptance, maybe my treatment planning or speaking with the patients, being transparent and kind of straightforward with the patient. Anytime I needed help, I think I had the doctor to seek help from. So starting from, managing patients to clinical questions, I always had backup.
Awesome. So kind of to piggyback off that, guys, we offer a 4-week mentorship program. So when you start with us as an associate, you are going to be paired with a mentor to work with you, whether that's the lead dentist in the office or the owner of the office. You are going to be paired with someone to help you to work with your hand skills, kind of figure out what your strengths and weaknesses are. And, what is it like every day or every week, you kind of evaluate how your week went, what you can improve on, what are some of your strengths, your speed, and things like that. So if you need more mentorship or if you need more time, I've had plenty of associates that have said, hey, Becca, I would just finish my 4 weeks. I think I still need some more time. That's not a problem. And it's a paid mentorship. So you're working alongside your mentor, working off their treatment plan until you're ready to kind of go on your own. But you're never going to really be on your own, because that mentor it's the network, right? That you're always going to have someone to help you. So tons of mentorship, guys. That's really huge with us. So we have a couple questions that just popped up live. So first question is, can you talk more about your ability to grow at Aspen Dental? And that's a good question, because I think you had tons of growth, Bo.
Absolutely. Just to go back on my background, my GPR program was very, like, hospital heavy, call heavy. I did gain a lot of oral surgery experience through GPR that I didn't have from dental school. So coming into Aspen, like you talked about, Becca, like the 4-week training course, the first week of training, I was very overwhelmed, just because I know Gurney is especially one of the busier offices as well. And we were seeing 30, 40 patients a day. And the first week I was like, no, I don't think Aspen's right for me, because I didn't believe that I could be clinically competent to do decent work on my patients. But
Even after your 1-year residency, you felt that way?
yeah, because during my GPR, I didn't have a lot of clinical experience. So I felt like I was actually behind on my speed, on treatment planning. It was, like I said, it was very hospital heavy. So we did a lot of bedside extractions. We did a lot of clearances for patients that needed to go in for transplants. And we took our patients to the operating room, but it's not the same as doing daily dentistry.
Right.
So I knew that I was craving that experience, and in private office that I was moonlighting in, I was seeing maybe 5, 8 on a good day, patients per day. And I just knew that I wasn't where I wanted to be. So starting out as an associate, I would say within the first 3 months or so, I think I grew a lot as a clinician, knowing how to do a proper class 2 even in a 30-minute time frame. I think that was something that, it's embarrassing to say, but even after GPR, I was spending, an hour doing 2 fillings, and I was spending 2 hours for a single canal root canal. So I think within the first 6 months, I grew a lot as a clinician, and I felt a lot more comfortable doing bread and butter dentistry.
Let me ask you this now. I want you to be honest, because I've heard this from a lot of folks, and we'll get back to the other, just your growth.
Mhm.
I've heard from some of my doctors that did GPRs or AEGDs that not necessarily that they regretted it, but they felt that their friends that went straight to work, whether it was with Aspen or somewhere else, that they learned a lot more, or they got further with their clinical skills. Do you feel that way?
I think people, well, at least I can say for my GPR program, I do think that if people go into an AEGD program, they do get a lot more advanced procedures, like full mouth rehabs. But GPRs in general, I think clinically, no, I didn't really get a lot of the clinical experience at all. So
okay, I heard a lot. I heard that a lot. That a lot of the GPR experience was hospital based.
yeah, I was
clinical based.
I was in the general clinic maybe once or twice a week to do actual dentistry, and the rest of the days it was being on call, running an OS clinic for undergrad students. So
awesome. I'm glad you said that, because again, some people have really great experiences in GPRs, and some others will say, I wish I would have went straight to work, because I felt like I came out just a little bit more behind than a friend of mine that went straight to work, right? So, so for all of you guys that are interested in GPR, pick the brains of those that have attended. That way you can really get, the experience or the idea of what's really behind it. Just kind of touching more on what the question was, can you talk more about your ability to grow at Aspen Dental? So I will talk to you guys about your growth and kind of the development stages. So you can come in as an associate, or you can come in as an MCD. Now, most of our D4 new grads come in as associates, especially if you are not as clinically confident, or if you know, hey, I didn't do a residency, or I still need mentorship. I just don't feel like I'm ready to kind of go in, gung ho. Then we have that opportunity for you to come in as an associate. So you have that mentorship. So you have, the time to really hone in on your clinical skills. You have the time to speed up. You're working with your mentor, you're working with the owner doctor, and there's really no pressure. You're an associate, you're learning, you're getting faster, you're getting better. We do have some doctors that come in as MCDs. Now, whether or not you're foreign trained, or you are just really good, you kicked ass in your interview, and the doctor feels like you have what it takes to be a leader, because not only, clinical you can learn, but being a leader is something completely different. So having the right bedside manner, having the proper leadership capability, whether or not you're able to lead a team. Like those are all things that they're looking for an MCD. So you have that growth space. So you have an associate, you have an MCD, then you have the owner of the practice. Now, again, all of our offices are individually owned, but as owners, they could take on a partner. So Bo's owner might say, hey, you know what, I love working with you. You're doing fantastic. And instead of me losing you to go buy a practice outside of Aspen or even buying a practice within Aspen, I would love to partner with you. And let's go 50-50 or whatever the partnership looks like. They would work that out. Or you said, you know, hey, I've been working in Chicago for 3 years. My life has changed, you know, stuff's happening. I'm thinking about relocating to Texas or California or New Mexico. We have a real estate team that will work with you if you're interested in, you know, owning a practice with Aspen, and then that would be your next step. So you do have that progression of associate, MCD, partner, owner, and it's really kind of endless. I mean, we have owners that own one practice and they're super content. We have owners that have 3, 5. We have large group practice owners that have 10, 12. So it's really your career and, like, you know, the path that you want to take. So Dr. Bo, talk to us a little bit about your potential possibility of partnering.
Yeah, so I was an associate for 6 months, and then I've been an MCD for 1.5 years. And my POP, the owner of the practices that I've been in, is Dr. Ashley Breyer. And right now she owns 6 offices in the Chicagoland area, and she's expanding. So I know within the next year or two, she's going to have several more. And because, you know, I work very closely with her, and you know, the practices that I've been in, we've been growing a lot. So she has been talking to me about potential partnership this year, actually. So it's very exciting. I think it's a great opportunity because a lot of the pre-existing owners, their offices are expanding quite quickly. And just in general too, I think Aspen offices, right now, I think we have about 850 offices nationwide. So it is a great opportunity that I'm very excited to take on.
Awesome. So yes, guys, the possibilities are endless. So we currently have 850-ish offices. We open, I don't know, I think it's 1 to 4 offices. We are the largest branded DSO, and we are just getting bigger. And there's an opportunity, if there's an opportunity, and if you have the will and the drive, there is a place for you. So tons of endless opportunities. Awesome. So the next question that just popped up is, does Aspen encourage and support and pay? Does Aspen encourage, support, pay for employee CEs? Yes. Go ahead and answer that, Bo. Yes.
Yeah. Yeah. So we get a lot of training, especially with some of the newer concepts that we've been learning with, like Invisalign and soon implants. There are a lot of online CE courses that we can take that Aspen offers for free. And we actually have the PSC in Chicago. We have a huge Aspen building there where they do offer more hands-on courses. Right now, because of COVID, you know, we haven't had a lot of hands-on experience, but before COVID days, yeah, I remember going there several times to learn more about removable prostheses, to learn more about bone grafting materials and suturing. So yes, we do offer a lot of free CE courses as well. I know with implant related topics are very popular nowadays, and we received a whole list of reading articles and chapters that we can look through when we have time at home. We also do these like online meetings with people in the implant field that have a lot of experience. So
absolutely. Awesome. So absolutely, guys. I mean, CE courses are endless. We have an online portal that has tons and tons and tons of CE courses. We actually opened it up to everyone in the dental industry during COVID. So that's actually available through March 2021. So I'll put that website up here shortly. That's open to all of our students, free CE courses. Like Dr. Bo said, we do have a training center, our Learning and Development Center in Chicago. It's right in the Fulton Market area. We host all of our implant training there, Invisalign training, our onboarding training there. You'll have an opportunity to take tons of courses there. And we're actually building a new Learning and Development Center in the actual Fulton Market. It's insane. I'm pretty sure we have like, I don't know, 10 or 15 floors that we're going to be using for tons of courses, learning and development, growth of our dentists. And we've just acquired Clear Choice. We're going to be doing tons. We just hired Dr. Joel, who is our new, I want to say, Vice President of Implantation. So we're going to be doing tons and tons of implants, and those CE courses are going to trickle down. So whether our owners take them, then MCDs like Dr. Bo, and then our associates. So tons of opportunities for CE courses. Awesome. Okay, next question just popped up. We had another one live that had something similar to CEs. What is the starting salary for Aspen Dental? And will international experience carry any weight in the hiring process? Does Aspen Dental cover CE courses? I can probably answer that one, Dr. Bo, because it's going to vary. So I can kind of touch on our pay structure because it's very different than most other DSOs. So our salary is going to be based off a daily guarantee or a daily draw. So depending on the location you're at, you're going to be given a daily guarantee. Now that can range from $500 anywhere to $700. I've seen them, up to $700, depending on the location that you're going to be working at. Now, places like Chicago have tons and tons of candidates. Now, Dr. Bo was awesome and lucky and was able to snatch one of these locations. But we honestly, guys, have candidates, like my phone rings off the hook with students that want to be in Chicago. The great thing is that we are expanding, but as of right now, like we don't really have tons of opportunities. So with that being said, Chicago probably isn't going to have to pay $700 because we have so many candidates that want to be here. But a place that's a little bit more rural, a place that we have a harder time hiring for, will probably have a higher daily guarantee. Okay, so that averages to about 150 to 145 to 145 to about 160,000 a year on average. And then we also have a kind of a bonus structure, if you will, or an incentive structure where we pay you a percentage of the growth or the profit of the office, the gross profit, Bo. So we pay you a percentage of the profits of the office. Now that's an incentive on top of your daily guarantee. As an associate, you can make anywhere from 8 to 10%. As an MCD, I think that goes up maybe 12 to 15% or 17%. That's something you kind of negotiate with owner, but you get a higher percentage of the office's profits. Now that is on top of your daily guarantee. I've seen some MCDs make 200,000, 250. We have owners that are making 1.5 million, 3 million, 5 million. It really depends on you, the office, how well you guys are doing, how established the office is, your patient retention. We thrive on patient satisfaction. We want to make sure that our patients are coming back and they're happy. So we're constantly sending out surveys to make sure that our patients are happy with their work. So with those surveys, that's kind of where, that patient satisfaction score kind of goes up and down. And that's also indicated on your, where you kind of fall in your incentive structure. So what do our doctors get paid? Starting at 145 all the way up to a couple million, depending on where you guys fall on what stage you guys are at. So there's that. Does international experience carry any weight? Absolutely. So that's kind of where, if you do have international experience, if you were a doctor in your previous country and then you came and did one of our ISP programs here, that's where you can possibly come in as an MCD over an associate. So you will definitely start at a higher daily guarantee and even get that higher, draw for your incentive. So absolutely, if you guys do have experience, that does hold weight. And then of course, Aspen does cover CE courses. So again, we have tons of CE courses online. Now, if there's a specific course that you guys want to take that's not offered through Aspen, have you done that before, Bo, where you found a specific CE course that you were like, I really want to take this. Unfortunately, Aspen doesn't cover it. What does that look like? Or will we cover it? What does that look like?
I know there were some CE courses that I was trying to negotiate with Dr. Breyer for. So if you guys have a CE course that you are really wanting to take, obviously, like the owner of the practice would have to see value in it. So if you can convince them, they can pay it for you.
Absolutely. I've seen that done a million times. So if there's a course that's going to cost a couple $1,000s and you're like, I really want to take this course, I think it's going to bring tons of value to the practice. This is what, you know, how it's going to help. You negotiate with your owner, like ask them. If they say no, then they say no. But if, you know, you say, hey, will you pay for half? And then, or can we get this taken out of my paycheck or whatever the, you know, whatever the situation is, it doesn't hurt to ask. And usually our doctors will say yes, unless it's some crazy off the wall topic that they're like, how is this going to affect your work here? Then maybe they're going to say, we'll think about it. But typically, if it's something that is going to bring value to the practice, then yeah, we'll cover it. Awesome, guys. Those are great questions. You're welcome to keep them coming. But I can go back to some of the questions that you guys asked previously. All right, so this is a good one here. What type of patients does Aspen typically see in their practice? And do you accept Medicaid?
Do you want me to answer that one?
Yeah, these are all for you.
Okay. Oh, okay. So
I'm just going to jump in when like I feel like I can add a little bit more, but no. You're the
So we see in my practice, we see kids. I am pretty selective with the pediatric population. If I feel comfortable treating a child as a patient, then I do whatever is necessary. I typically, I think Aspen in general, we see a lot of older patients as well, maybe patients in their 50s, 60s, 70s, needing to get work done. A lot of them haven't been to the dentist in a very long time. So there is a fear component, just being fearful of being at a dental office, and of course being fearful of, oh my gosh, like I know I need a lot of work done. It's going to cost a lot of money. So a lot of our patients are also, they're living paycheck to paycheck, blue collar patients as well. We don't accept Medicaid, but we do offer great financing for our patients. We offer care credit with like no interest for 18 months. We also offer Genesis if they don't get approved for care credit. So that financial barrier, like we definitely help them out with. But yeah, we do, because of the patient base, I think we do a lot of partial dentures, a lot of full dentures. We do have a lot of immediate cases as well. But we also have a great in-house lab technician that they could make everything for you.
Absolutely. So just to kind of piggyback off that, guys, we don't usually see kids, right? We're not a pediatric dentist, but we do have some that come in, a lot of families that'll say, hey, will you treat my 10-year-old or 8-year-old or whatever? But that's not really common. We do see a lot of blue collar. I think we see a lot of patients that you guys would typically see at school, right, Bo? Not take any Medicaid. We do take all other insurance. So we're not necessarily selective about the insurance because we do take all insurance, but we also have the opportunity to do like care credit and payment plans and things like that. So we are probably one of the few DSOs that do not take any sort of like government issued insurance. So you won't have to worry about seeing a lot of those type of patients, but we do, again, like Bo said, we have tons of denture patients. I know that is a misconception that Aspen only does dentures. And I want to say people feel that way because we do dentures really well, because we have labs in every single one of our offices. So Bo, do you remember how long it would take you to do dentures when you were at school?
A very long time. we would literally bring the patient in for every denture step, and every denture step, I think it would take at least several days to a couple of weeks to bring them back from like impressions to wax bite or wax bite to wax try. But I think if I remember correctly, in dental school, like it would take me at least a whole month.
Month.
Yeah, make someone a set of dentures. Yes.
So what's the average with our labs in office?
We can get like a replacement denture made within a week. If
Right.
you really wanted to get, if someone had to go to a wedding in 3 days, we would make that work.
Right. I mean, I remember I was in there, I brought lunch for one of the offices, and a gentleman came in and he had broken his tooth, and he had an event or something, or he had broken his denture. And I remember the lab technician was just like, okay, I can get it done in like 2 or 3 days. It's going to be rough, but I'll get it done. So yes, guys, turnaround will be anywhere from, a week to, a few days versus your month and a half, or whatever your turnaround was in school. So the procedures for dentures is completely different than what you're used to at school. So are we a denture mill? No, not necessarily. We just have perfected dentures and we do them well. And because the turnaround is so quickly, people come to us for dentures. So that's just kind of what it is. And the fact that we have a technician working right behind you, in the lab, that will come out and you can go in there and say, hey, can we fix this? Can we tweak this? And all that turnaround is just so quick. So I think that's awesome. Okay, cool. So moving on, we have a live question that just popped up. Will Aspen support in any ways if one of its dentists decide to specialize down the road, provided the dentist comes back to join Aspen after finishing specialization? Have you had any experience with that, with one of the docs that you've worked with deciding to specialize?
No, I haven't.
Okay.
Yeah.
So that's a great question. We're going to support you in whatever you want to do. If you, come in as a general dentist and you're practicing with us for a few months, and then you decide, hey, you know what? I really love endo. I think endo. Now, keep in mind, guys, before I even go into that, our specialty that we actually have in office is endo and oral surgery. Now, Dr. Bo, do you have endo and oral surgeon in all of those offices, or what does that look like?
We actually don't have an endodontist in any of our offices, but we do have an oral surgeon that comes at least once a month. If you need him twice a month or 3 times a month, he'll come on those extra days.
Okay. Now, why don't you guys have an endo? Do you just not?
To be honest, I think because a lot of the patients that come in through the door, they're in pain by the time we do the exam and we tell them, okay, you need to go see an endodontist for this, number 2 or 3 root canal. And it just doesn't make sense to have an endodontist in our office. It would just be more efficient if they could be in our office once a week or twice a week, so we can get our patients out of pain as soon as possible.
I see.
Yeah.
Well, with that being said, is a lot of our specialty travel, right, guys? So our oral surgeon will go, we'll have 5 or 6 or 7 offices that they're traveling. So they'll, stop at Dr. Bo's office once or twice a month. They'll fill that schedule if there's overflow, or if you need it longer or extra days, and he'll come extra days. I know that a lot of the offices, the South Chicago offices have endo. I know Skokie offices have endo.
Mm-hmm.
But that's probably because they have more endo cases, possibly. I mean, it just really depends. So we do hire endodontists, we do hire oral surgeons, and then typically those are traveling positions where you spend 1 day, in each office. It's kind of a nice little gig because you get a corporate car, you get all your hotels paid for, you get all your meals paid for, and they make some good money. So if you're interested in specializing down the road, I want to say Aspen will definitely support you. I don't know if they will support you, financially through the process, like pay for any of your schooling or anything like that. I do know that if you decided to moonlight and still work with us for a couple of days and then, go to school, whatever the case was, we would support you 100%. I just don't know if we would help pay for any of that. continuing education, right? If you decided to come back, then you'll definitely have a foot in the door because you've already worked for us in the past. So that's kind of a good thing. Okay, so I hope that answered your guys' questions. Next question. How many days do Aspen dentists work for a week? Can full-time Aspen dental dentists work part-time at your other offices? Wait a minute, let me read that again. How many days do Aspen dentists work for a week? Can full-time Aspen dental dentists work part-time at other office? Are you asking, whoever asked that question, are you asking if they can work in a different practice outside of Aspen? Now, our full-time is anywhere from, is it 35 hours, Bo? What's considered full-time? 40?
40. I work 41 hours right now.
Okay.
So Monday through Thursday, we have 9-hour days. And then Fridays, we have a half day from 8 to 1.
Okay. So, and I want to say most of our offices have taken on a similar schedule, right? Typically, you'll have like 2 late days where you're working until like 7 or 8, depending. You'll have some early days, and then most of our offices have short days on Friday. So it's like 8 to 12 or 8 to 1. And then you will work maybe one Saturday a month.
Mm-hmm. Yeah, one Saturday a month.
Okay. So on average, 40 hours. We do hire part-time dentists. We don't hire them too often because, you know, for instance, Dr. Bo's working full-time. So unless Dr. Bo says, hey, I want to go down to part-time, or Dr. Bo gets married and has a baby, or something happens where someone wants to, you know, cut down their hours, or maybe the owner says, hey, you know what, we're actually extra busy and would need some help on Tuesdays and Thursdays. So it's not uncommon, but it's not super common. So yeah, we do hire part-time. Now, could you work for Aspen and work for another DSO or another private practice? Yes, we don't have a non-compete. We don't have what is that, covenant per se. So you guys, I mean, I think that's really important because a lot of other DSOs, when you sign your agreement or contract, please pay attention to what you're signing, because a lot of times they'll say, have a non-compete, so you cannot work with any other DSO for the next 3 years, or you have a covenant of you cannot work for any other private practice or any other DSO within 5 miles or 3 miles. We don't have any of that. We are very much in the practice of, if you love your job and you're happy here, great. If you decide this is not the right fit for you and you want to go work across the street, then go work across the street. We're not going to want to keep you or hold you hostage. And there's definitely nothing in the agreement that'll say that. And our contracts aren't really contracts, they're just letters of agreement, because you're not contractually obligated to stay with us for any time either. So if you decide, hey, you know what, I've been here for 6 months, it's just not the right fit for me, I think I'm going to go interview somewhere else, then you have our full support. And if you leave on good terms and then the grass is not greener, you want to come back, that's cool too. Cool. Okay, that's a good question. Did we answer that one? Yes, we answered that one as well. Keep your questions coming, guys. We answered that one. Okay, let's get back to some of the other ones you got. Okay, why Aspen Dental and not some other DSO? Did you interview anywhere else when you were looking?
Yes, I did.
Okay.
I lived in New Jersey, so I wanted to come out to Chicago and have like all the interviews lined up. So I actually had a full week of interviews, I think 7 interviews in 1 week.
You're busy.
I interviewed for some private offices. I interviewed for some of the other DSOs. Like, do I need to be specific and say what those DSOs were?
You're welcome to. I mean, you don't have to if you don't want to.
So I interviewed for DSOs, All-Star Dental. I also interviewed for Dental Dreams, and also there was one other one that I can't even remember now. But I would say, like, for instance, like All-Star Dental, they see mainly pediatric patients, and I don't feel 100% comfortable treating huge pediatric populations. they also did a lot of amalgams, which I did not want to continue doing. Same thing with dental dreams. They have, it's kind of like being in dental school where you have like 7 ops and you have like 7 doctors and just working all day. And again, they did a lot of amalgams because they see a lot of Medicaid patients and, you know, with the whole downgrading composite to amalgam. So when I came to Aspen for the interview, the person that interviewed me focused really on like what our main goal is, what kind of patient population we saw, breaking down those like barriers for fear. And it seemed like it was geared more towards like providing the best patient care. Also at Aspen, I think it runs a lot like a private office in a way that as an MCD, I can order whatever supplies I want to order, whatever composite I want to try, whatever metric system that I want to try. So I think having that full autonomy Aspen is what drew me into it compared to some of the other DSOs. And comparing like DSOs in general with other private offices, a lot of the private office interviews that I went to, they were asking me, you know, what I was wanting, what I was looking for in this experience. And I said, well, getting patient experience, clinical experience is what I'm looking for right now. And I cared more about that than like how much I was going to get paid. And pretty much all of the private owners told me, okay, like initially you're just going to be doing very basic bread and butter dentistry, like fillings, maybe a crown prep here and there, maybe a root canal. So there seemed to be a lot of like unknowns, like what am I going to do if I start working for you here? Like, am I going to be doing fillings all day? And yeah, I didn't want to have that experience. So I'm not saying all, you know, DSOs are like that, and I'm not saying that all private offices are like that, but that was my experience throughout that whole week where I had, you know, a lot of interviews. So
I'm glad. I'm glad that you were able to experience, you know, an interview with a whole bunch, because that's huge. Like you want to really see what's out there. So a lot of you D4s that are interviewing, I mean, we are super transparent where we say, here's your agreement, read it over. If you want to show it to whoever else you're interviewing with, like we're not hiding anything, right? And also like, be super transparent and like have them be super transparent. Read over that agreement, show it to your parents, show it to a friend, show it to a lawyer, because a lot of these DSOs are really sneaky. I think our agreement is like 3 pages where it talks about your schedule, your pay, your benefits. I used to work for a DSO, one of the ones you named. I'm not going to name the DSO, but you named one of them. I'm pretty sure a lot of you guys that I know know where I worked before. But that agreement, and that was a contract. It was a 2-year contract. Okay. So there's a difference between an agreement and a contract. So that contract was 13 pages. And there was so much legal jargon in there because one of the owners he's a lawyer. So he wants to cover himself and cover his butt as much as possible. So definitely do your homework, guys. Interview with as many DSOs or private practices, see what's out there, see what's going to be the best fit for you guys. And if you interview with us and you say, hey, this is a better option for me, then cool. Like we want you guys to be happy. But if you come work for us and think this isn't the right fit, then that's okay too. We're all for it. Okay, we got some more questions that came in. Does most Aspen offices have a digital pre-scan mills?
we don't have a digital like Emacs crown mill, but we do have, all the offices have the iTero scan. So for crown impressions, bridge impressions, Invisalign, we do, even for partials, we scan everything that we can.
Awesome. And the great thing about the iTero scanner, I want to say, is like your assistants do most of that, right?
Yeah, the assistants are very well trained. They can do a full mouth scan within 3 minutes or so. Yeah.
And because, so are you guys doing tons of Invisalign in your office?
Yes, we do a lot of Invisalign. And
Awesome.
what's also great about having the iTero scan is that for all the new patients that come in, we scan them and they can see all the calculus buildup in the scan. They see all the broken teeth, they see all the cavities. So it's really easy for you to explain to them, like, this is what's going on, even though you're not having pain. Because a lot of the times, like, people come in and they're like, oh, I don't have anything going on because I'm not in pain. But we all know that that's not true. So if you have the scan right in front of you and you're showing them this is a cavity, they believe you 100%.
Absolutely. I was floored when I saw my iTero scan. I was like, oh, wow. Do my teeth look like that in person? And I was convinced to get Invisalign after I had, braces for 2 years as a kid. So very convincing, guys. iTero scanners are fantastic. Okay, so this question's a good one. What has been the hardest adjustment in the real world as a dentist versus being a student? What is your biggest adjustment from dental school to the real world?
I think being the leader of the practice, I never really consider myself to be a leader before I came to Aspen. So learning how to deal with difficult patients, for example. Like in dental school, if I had a patient that was giving me a hard time, like I would just go to my instructor and they would help me through it. In the real world, if you have a difficult patient, you have to learn how to manage them and you have to still stay professional and help them out and learn your boundaries. So I think that has been a big challenge for me, as well as, like I said, managing staff, because I want my staff to be happy. And it's overall like a really great experience to have. I don't know where else you can learn to manage an office without being an owner. So, and you can be as involved as you want. You can be as, hands off as you want as well. We have a lot of support from ADMI side. We have a lot of, people that come to your office to help you with staffing issues as well. So, but yeah, sometimes managing people could be the hardest part.
Absolutely, because I think you guys learn clinical. You don't really learn how to manage people, and you guys don't really take business classes, right? Like how to run a practice.
Mhm.
So I'm glad that you mentioned that because, guys, we have a full support system. So, like Dr. Bo said, she can be as involved or as uninvolved. So if she wants to be involved in the hiring and firing and the day-to-day, then she can definitely be involved. But if Dr. Bo as an owner says, hey, I want to be hands-off, I just want to practice dentistry, then you have an office manager, you have a regional manager, you have a director, you have us on the talent acquisition side that will help find you the right staff. You have endless amounts of support, but you can't really be taught leadership. So it takes the right person to be able to come in and lead an office. And that's kind of where your growth comes from. And that's where you're going to see, people like Dr. Bo going from an associate to an MCD and possibly going into partnership and ownership because there's that drive and you've been doing so well. So I'm so proud of you, Dr. Bo.
Thank you.
Okay, next question. Will Aspen dentists be allowed to place implants? And any Aspen clinic has CBCT scanners?
Yeah. So it depends on where you are. Like when I was an associate in Gurney, they already had all the systems for Nobel implants. So during my residency, I placed several implants. So I felt a little bit more comfortable. I did place several more when I was an associate. Now that I'm in MCD in Algonquin, we don't have the implants system. So that is something that I'm trying to negotiate with Dr. Breyer right now, so that I can continue to place implants. And going to the second question, the cone beam CT, our office has been open for a while, so we don't have a CBCT, but all the newer offices come with it. So some of Dr. Breyer's offices have the cone beam CT machine.
Awesome. Now, do you also think it's patient based? Do you feel is it because your current office, do you feel like they don't have as many patients are wanting implants? Is that why there isn't one in there, or what do you think that is?
I think right now, because we have an oral surgeon that comes and I think our patient demand maybe is not high enough where I think it would be profitable for us to have a CBCT and an implant machine, but the oral surgeon comes with it, and he could place all the implants. We have a lot of overdenture patients. So
Okay, so I'm glad that you mentioned that too, because you said you're going to negotiate that with Dr. Breyer. So you guys want, guys, again, if you feel like it's going to be profitable and it's going to be something that you want to use and do, then bring it up. I mean, more so, yes, and they'll say, okay, let's get one. But you did mention all the newer office do have CBTC scanners and iTero scanners, and they're pretty much state-of-the-art digital offices. A lot of the older offices, and again, guys, all of our offices are built from the ground up, so we don't acquire any offices. So we don't go in and buy any offices. Everything is built from the ground up. So we do have offices from when we first opened 20 years ago. We've been in practice now for 22 years, 23 years. So we have offices from 20 years ago that we're constantly trying to upgrade, but it's a process because we have so many. But all of the newer offices, especially Chicago's a newer market. We've only been in the Chicago market for 3 years now, roughly. Or maybe, I want to say when I first started with Aspen is when we had recently launched in Chicago. So all of those offices are going to start coming fully digital and with all the good stuff. So awesome. Great questions, guys. All right. We have less than 10 minutes left. We have a couple more questions we'll get through, guys. If there's any follow-up questions that you might want to ask, please don't hesitate to jump those in. And then for all of you that have stayed through the end, we'll do a quick raffle at the end as well. Cool. Okay. How long did it take you to transition your speed once you started working after dental school? I think that's a question we get a lot.
I would say about 3 months. Yeah, I thought it was going to take me a lot longer, to be honest. But when you're in a busy environment every day and you're pushing yourself, and as long as you really are motivated in learning, I think that period shouldn't be more than 3 months. And it probably won't be more than 3 months. I mean, I've seen a lot of new doctors, new grads come through. I've trained several of them, and most of them learn to work quickly within the first 3 months.
Awesome. So I want to ask this question. I'm just having a hard time understanding it. Let me just read it out loud. Did the stress of going through dental school ever seem too overwhelming and make you question your decision to pursue this career path? If so, how were you able to overcome this, and what pushed you to keep going? Did the stress of going through dental school ever seem too overwhelming and make you question your decision to pursue this career path? Did you ever question your decision to go to dental school?
Sometimes. I mean, I love what I do. I really from the bottom of my heart, I love what I'm doing right now. And I love that I get the feeling that I'm, learning how to manage an office. I'm learning how to talk to patients. But not every patient is going to, and this is the same in dental school. You don't always have those patients that listen to you and respect your recommendation or just trust you completely. So yeah, I think I get very, very I want to do a good job, and I want to make these patients happy, and I want to make them smile. So when they are upset and you've done your best, like with denture patients, right? A lot of them have no bone in their mandible, and they come in expecting the lower denture to be as good as their upper denture. So when I get those patients that are disappointed, yeah, I'm like, oh my gosh, I'm trying so hard and I've done my best, and maybe I don't think I've ever regretted this path, but there are definitely days where I feel like I'm discouraged.
Yeah.
Yeah, but I think that's, no matter where you end up going, I think you might feel that way. Maybe you're a little bit harsh on yourself, but No, dentistry is great. I know we all have like a lot of student loans, so sometimes you got to think about what's what's realistic too.
There's a light at the end of the tunnel, guys.
Yeah.
But I think you got to think about that, right? Your student loan debt. So I'm glad you brought that up, Dr. Bo, because, I know that a lot of the folks that are on this particular call might be interested in being in the Chicago market, right? The Chicago market, guys, is so saturated right now. Like we have SIU, UIC, Midwestern, Marquette, Indiana, all of these schools want to be in Chicago. So it is kind of, it's a battleground for the very few positions that we have. So if you are open to, locations and other opportunities outside of being in a metro area, you're going to have an abundance of opportunities. So if you know that you have some insane student loans, we have tons of opportunities that have student loan reimbursement, that have larger sign-on bonuses and things like that. So if you're like, you know what, I really love Chicago, but I'm open to going somewhere for the next 2 years to help pay off some of my student loan debt, then that's a great opportunity to look to see what other locations are out there, because we all know Chicago's fantastic. I love Chicago. It got a little expensive for me, so I dipped out. But I do miss it. I don't miss the cold though. It was 75 degrees here today. Just saying, Dr. Bo.
That's so nice.
Not rubbing it in, but I'm kind of rubbing it in. But so, if there's an inclination of, you know what, I'm open to some other locations, then explore that, because student loans are intense, right? And you're going to have them for a little while. So you can pay them off just a little bit. Let me know if you want to explore some other options. Okay, so we have maybe a chance for 2 more questions and then we'll wrap it up, guys. You guys have been fantastic. So this question just popped in. Would I be able to move to a different Aspen practice in a different location if I have already signed a contract with another Aspen practice? Yeah, Bo, you've kind of moved around, right?
Yeah. I've actually, I worked in the Algonquin location for the last 1.5 years. And I kind of, for my career wise, I wanted to have the experience of building a practice from ground up. So a new office opened up in Antioch, Illinois, and I requested to take over that office, leave my office once we get this new doctor trained, so that I could get the experience of what it's like to, start fresh with new staff, new patients. So yes, if you are willing to, or if you're wanting to move to a different city, there are tons of Aspen offices everywhere. So it's definitely something that Aspen could accommodate for.
Oh yeah, guys. If you've already signed an agreement, if you've been working for us already for 6 months and your boyfriend, girlfriend, husband, whatever, got accepted into a residency across the country, and you're like, I have to move, that's not a problem. We will try to accommodate. We'll try to figure out what options there are, what locations there are. Now, granted, if you move to a place that doesn't have an Aspen, like that will be a little bit difficult, but we'll definitely do everything in our power to make sure that we keep you within our network. If you just signed a contract and you haven't even started working yet, then, that's also a conversation that you can have with me, with your recruiter, just saying, hey, I just signed a contract in Indiana. I'm really interested in New Mexico, whatever. Or my life has changed. We're all at the age where life is happening and things are changing. So if anything changes, you just ask. It's just a conversation that needs to be had. We are super, I think we're all human and we understand circumstances. So definitely ask. All right, guys, our time is up. You guys have been fantastic. If there's any other questions that, I only missed a few that were on here, but a lot of them were just kind of repetitive of the conversation we were already having. So, but if there's anything else that you guys feel like you want to know or have any questions or anything, please reach out to me directly. My phone number and my email address, I'm sure, is on the email that you guys got. Dr. Bo, are you okay with them reaching out to you if they have any questions?
Yeah, absolutely.
Awesome. Now, are you guys, Dr. Bo, are you guys doing shadows at all for any D4s that are interested in maybe touring the office?
Oh, if anyone wants to come and check out my office, yes.
Love it. Okay,
yes.
cool.
Our office,
So
everyone
awesome.
in my office will be very welcoming.
Love it. I really missed you guys in Chicago. I mean, sneaking in there and like buying donuts and like lunch and stuff. I'm kind of sad about that. I do have an Aspen like 4 minutes away from me. I haven't said hi yet. I don't know. We'll see. We'll see. I'll go bring them lunch maybe. But if you guys, our offices are, everyone in our office and our staff is so friendly. So if you guys are interested in doing a shadow or doing a tour, let me know and I can help set that up. Dr. Bo's fantastic. She can give you a tour and just kind of hang out and meet the staff and things like that too. Excuse me. Give me a second. Let me chug out of my gallon of water. I'm almost done, guys.
You're almost there.
I'm almost there. I only have
This is
much
mine for the day.
I'm on this challenge that's kicking my butt. Okay, so lastly, again, if you guys have any questions, please reach out to me directly. I know there's some great people on here that I know personally. Thank you guys so much for jumping on. Now we're gonna do the raffle. Excuse me, and I'm also gonna pull up the free CE courses. Which are free through March, guys. So these are completely free for all students. Please log in, take full advantage of those. So while I'm doing that, Bo, I'm gonna need you to think of 3 numbers between 1 and 14. We have 14 people that are left on this webinar. So I'm gonna have you pick 3 numbers and then I'm gonna find out who's what number and then I'm gonna let you know who wins.
All right. 6.
Mm-hmm. What
13.
13?
Yes. And 1.
All right. So our first winner is Adisha Odadina. If that's you, send me a message in the private chat, and then I'm going to shoot you over a $50 gift card. And then number 6. Minji Chan, congrats. Send me your phone number through the chat and I'll send you a $50 gift card. And then lastly, you said 13 is, drum roll, Yang Basi Dong. Yang, our winner. Nice. All right, guys, I'm more excited than you are. So these 3 folks, send me a message through the chat with your phone number and I'm gonna send you guys an Amazon gift card, $50 right now.
Nice.
Awesome. All right, guys, thank you so much for being on. Dr. Bo, you've been fantastic. I miss your face so much. Now COVID is under control and I can come back down to Chicago and drag you to some events in person.
That would be fun.
Thank you so much for being on. You were fantastic.
No problem. Thanks, guys, for joining us tonight. Thanks, Becca, for putting this all together.
Thank you. No problem. You have a good night. And for you guys that are interested in the free CEs, I'm going to pop that up right now. Actually, just send me a message and I'll send it to you guys. Don't worry about it. Everyone else, you guys have a great night.
Have a good night. Bye.
All right. So, Bo, you can jump off. You're fine. I'm trying to figure out the folks that won here.
Hopefully I can see you in person really soon.
Absolutely. Take care. Have a great day.
You too.
Bye. Okay, I got my 3 winners. Hey guys. Adisha, you're on here. You're good. Can you just put your number on here so I can send you a message? Minji, I got yours. And then Yang, I have your number already, so I'll send you. Perfect. I'll send you guys, I'll send all of you a $50 gift card in the next 10 minutes. Cool. Thank you guys so much for being on. You guys were awesome. Have a good night.